I want to bring in Frank Luntz right now, a pollster and Fox News contributor. Frank, good to see you.
Thanks.
So what do Americans want when it comes to Obamacare?
They want a combination. They absolutely want it repealed, but they want it even better than replaced. They want it repaired. And I give Senator Ron Johnson credit for this because in his presentations he said, wait a minute, if we only repeal it and we take months or years to repair it, then the voters are going to say, why should we trust you? Why should we expect that what comes next either will pass or will have the types of changes they want? Two things from Obamacare that must stay. The first is keeping kids up to 26 on their parents' plan, and second is protections against pre-existing conditions. Two things must go: the mandates and the absolutely skyrocketing costs. So that's where the public stands right now.
Yeah.
What are the most damaging attacks against the repeal and replace idea that Democrats have been able to use effectively?
Most is, well, what's your plan? Because the House has a plan, the Senate has a plan, Paul Ryan has a plan, the incoming Secretary of Health and Human Services has a plan. And they're all about 85 or 90% the same, but it's in the details that there's a difference. And here's the greatest challenge for them. The Republicans want this gone now. Like, as far as they're concerned, even if Donald Trump hasn't been inaugurated, this thing should have been gone.
Right.
The independents want it to be gone, but they want you to be careful, and the Democrats simply want it to stay.
Shouldn't the Republicans be careful, though? Because if you just wholesale repeal it or repeal what they can under reconciliation, then they own it. If it's a problem and if the fix is not put in place with speed, then it is their problem. Right. And the messaging becomes, again, the messaging so far has been make America sick again and chaos. You hear those words over and over and over again.
Which no one believes, because that was the same approach that they took when they were trying to pass this in the first place. I think it was Congressman Grayson, who said the Republican plan is die quickly. Yeah. But there's one thing that no one's talking about. They don't want bureaucracy. They want to get control over their health care choices right now. And they believe that nothing should interfere with the doctor-patient relationship. And these are things they think they deserve, that they're fundamental. Well, so it's not just about policy, it's actually the care.
The cost is really one of the sick parts of this plan.
Can I tell you,
116% increase in Arizona alone
I talked to, somebody pulled me aside yesterday. A longtime friend does not work for the Fox News channel directly any longer, and said, my small business, I have a $10,000 deductible, I lost my health insurance, my premiums have gone through the roof, and now I'm forced to negotiate one-on-one with my doctors for what I pay for services, because I can't meet a $10,000.
So what is he going to do? He's going to cut jobs, or he's going to turn full-time jobs into short-term,
and now he's standing around waiting for the replacement.
I lost my health care. Now, I got in trouble for saying this, and I'll acknowledge it on your air. I haven't been to a doctor in many, 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 many years, and they still cut me off, thanks to Obamacare. So, no, I couldn't keep my doctor. I couldn't keep my health care plan, and I'm the most profitable person I've ever had.
Let's talk about Congressman Tom Price, because he's the guy who has this in his lap right now. He had his confirmation hearing yesterday. Wow, what a grilling he got. Do you expect him to get confirmed?
Absolutely.
Yeah?
And I absolutely do, because he knows more about health care than any other member of Congress. This is a guy who's lived it every single day for decades. He knows the details. He knows the ins and outs. And I think that's exactly what the public should want. And that's the one thing that Donald Trump has done. Well, there's several things, but on this he should be applauded. Each person who he has appointed is an expert in their field. That's very impressive.
It really is.
And I've made the argument that Obamacare kind of repealed itself. It's just unworkable, and it's collapsing. High premiums, high deductibles, fewer choices. That's not what we were promised. I have to tell you, I know a lot of conservatives got concerned when Donald Trump talked about universal coverage recently. I think that's a brilliant way to phrase this. You can have universal coverage if you make health care universally affordable. And the problem with Obamacare was it never addressed affordability.
Yeah.
And I don't think we should shy away from saying, yes, every American should have access to quality, affordable health care, and that should be a goal we have.
Just not that government runs it.
It just shouldn't be a government-run program, and you should do it through the free market.
It was gutsy that Tom Price yesterday, Elizabeth Warren was bearing down on him to say, I want you to repeat what Donald Trump said, that he's not going to touch Medicare or Medicaid, and Tom Price wouldn't do it, and he said it's going to depend on the quality of the health care coverage. And Elizabeth Warren goes, you might want to print out President-elect Trump's statement and post it above your desk in your new office.
That was a pretty good Elizabeth Warren.
Yeah, it was.
Well, but
It was
again,
actually frightening. I'm tempted to jump off this thing.
Yeah, really good
but
impersonation.
again, the lecturing and just the nastiness.
Look, get used to it. That's the way politics are going to be over the next 4 years.
Well, they can't get their head around Donald Trump.
And they never will. And the truth is, many in the media won't either. Many in the establishment won't. They will never accept this.
Wow.
And the tone is so negative.
Then it's going to be a tough 4 years, if not 8 years, for those folks, because guess what? There's a new sheriff in town.
You got it.
Frank Luntz, good to see you, sir.
That's why I'm wearing
so
the new
much.
shoes.
I like your sneakers.
If there's a new sheriff, I need new shoes.